do this at the time, but I know what it is. So our fair revenue is what's going to be included on that first page. And I can just start out by saying that we don't have a lot of changes in our revenue. It was actually a conglomeration of our 2019 fair, which was like a record attendant fair, a little bit of our 2021 fair, and then taking a best guess, obviously, on what our 2022 might look like. So I am looking at right now in the county fair line, it's 180 is the fund. So our fair revenue again remains pretty much consistent. Our off season, we have a few things that have been added. We have at the top on 4250, we have our state grants. That's the first time I think that I probably put money into that pot right there. And that is actually funding that came through Business Oregon. So it came down from the state. All of the fairs, we have a $10 million pot, will be split amongst all 36 county fairs, and this is an application process. They will only fund half of the fairs in the first round, and you only receive half of the funds. So it's a half of a half if your application is taken. So I added that to my line item here, hoping that my application will be accepted and we will get to spend that money in the next fiscal cycle. We have also added in our local community funding that has since been divided out. And Sean, I don't know if we need to show that here or not, but I have a new line item of 4285, which is the TLT funding that has been allocated to the fairgrounds that we would receive every year outside of the application process. So 250,000 of that is included here, and then another 10,000 for just community funding grants that are local. The only other items in here would be my beginning balance. I can tell you how that was accumulated. For this year, we did have about a $70,000 carryover of expected revenue that I either brought in that wasn't expected or I won't be spending. We have 154,000 of expenses that again won't be expected this year for whatever various reason, whether it was personnel that I don't have or just expenses in general. We do have a $40,000 contingency that we roll over every year, and then combined bank accounts are about 18,500. That kind of is a rough idea of how that balance was calculated. And it's a moving target, but we're going to go with it for the budget process. So any questions on revenue before I move on?
What kind of commitments are you making? I usually ask who the main entertainers are and what are provisions if for some reason the medical situation takes an about face and things go bad, and do the contracts typically have like a force majeure or something where you can get out? You know, if the government says, well, you can't do this, you got to do that, or mask up or whatever.
Right. So it does have a clause. However, unfortunately for me, these are large entertainers, and I will have to pay their contract depending on when that time comes. We would obviously ask for some grace because you know, it's unforeseen. They could cancel on me in the same regards. So it's a very complicated kind of a contract that we have. The only one that might potentially have an out clause because we wrote the contract ourselves would be a tribute band that we have coming in from Portland. But as far as the national acts, their contracts are pretty tight.
So we don't have
no act of God, there's no overlying anything that would exclude me from that contract.
Can you say who your headliners are, or is that too early?
I was going to announce those on Friday, but it actually got pushed to the 22nd. So all I can tell you is going to be fabulous.
Okay.
It's gonna be fabulous.
Is that good? We have one tribute band, and then we have a national act that is country, and then we have a third act, which is an up-and-comer of both
far as I know, she doesn't have any office help, and I did mute.
Okay.
I had a sign on there, but because people don't see that, my apologies. Anything else regarding, regarding the actual,
So what,
revenue?
what about the pari-mutuel betting now? What's the status with that? I know that the guy down in Grants Pass, I've been sort of following it because I like to go to a casino horse race now and then, and I know he got shot down pretty much by the state and others and maybe the tribes on what he was trying to do beyond the horse racing down there. Is he,
Correct.
so is there anything going on behind the scenes on pari-mutuel betting that would be of concern to us, or what do you know? In other words, what's the inside scoop, or can you say?
Excuse me, yes, of course I can. That's been a conversation that we've been having the last 2 days. It just was announced that Grants Pass Downs, which Travis Borbo owns that particular track, or not the track, but he manages the facilities. They will not be running this year. And that is going to be devastating for all of the fair meets because we rely on them. They open up early in April. They start their first day of racing would have been May 9th. And without that there, those horses that come from all over the different states don't have a place to train. So if you don't have horses that are fit, it makes it very difficult to start the first race meet out in Union and expect those horses to be ready to run without possible serious injury. So a lot of them will probably go back to either a Washington or a California track to train, and it's very difficult to get them to come back to Oregon for purses that, the purse money that's paid out, that is very small. So, you know, we may have a $8,000, $10,000 race here or at Prineville, but you're talking $30,000, $40,000, $80,000 in other states. So you can understand why those horsemen and women and breeders will go wherever they need to go. So we have a meeting with, like we do every month, with the Oregon Racing Commission and the fair race meets, as well as all of our stakeholders are on those calls. We have a call coming up on Tuesday. Should be very interesting. All of our race applications have already been approved for the summer fair meets. Our funds have already been allocated. So we in fact could have a race. We can have betting. Betting is not a problem for us. The problem that Travis had with the Flying Lark was it was historical betting machines. That was the problem. Just advanced wagering, just normal betting in person or on your phone through advanced deposit wagering is not a problem. That's probably more than what you wanted to know, but
No, that's very, very useful, thank you. And
Yeah.
to what, and this, I know, probably have no way of knowing this, but how many people come to our fair exclusively for betting? Because I see people there that I've never seen before. That doesn't mean they don't live here, but, and I see plenty of people who live here, but I'm pretty sure there's a group of people who follow racing around. And so, is that 5% or 10%, or do you have any way of knowing?
we really don't have any way of knowing other than by recording the number of tickets that we either sell or promo or comp to certain areas to get the race bettors to come. We average, it's about 2,000 a day, say, in the stands. So you could say that that's, 1%, 10%. I mean, you could do all kinds of calculations, but really how we gauge it is what our profit margin is for the betting, and then all of the things that go into it, which is our beverages, our food. Typically from noon to 4 o'clock is typically when we see our biggest gross in sales, and that is because of horse racing.
Well, most everyone who goes seems to enjoy a drink or a hot dog or something, and so, yeah, I can see the connection for sure.
Yeah, if horse racing goes away, which we're hoping that will be funded for at least this year and possibly next year, if horse racing goes away, it will definitely hurt the entire state as well as Tillamook County.
Other questions Tammy?
Would you like me to go ahead and move on just to highlight some of our expenses that we?
Yes. Yeah, keep going.
Okay, all right. So for our expenses, in fair related, we don't really expect any kind of, growth in our fair staffing or anything like that. If anything, I will probably be paying it more in like a contract, hiring either companies or organizations to do things, not individual people, because of lack of, volunteers. But, our permanent staff will stay the same. The increases that we would see, again, are in the contracted services, either hiring it out as agencies or people who can actually do the work for us, because our volunteer pool is getting very small. So we will see a slight increase in those services, as well as security in that area. We are also looking at doing some online ticketing, so there's added expenses to some of that. But we may save on the printing side. The parimutuel, we have pretty much made that the same as all the years past. We bring in as much money and we expense it out on the other side. Not a lot of gain there, except for what we make on wagering, which we'll see at the end of the fair. So that is my fair. The next one is 18001, which is my off-season. I am currently the only employee at Tillamook County Fair. I am expecting to get 2 full-time staff in the office. We used to have 2, then we went to 1.5, and then with COVID, we went to a couple half-time, tried to get 1 person to come back full-time, and now they have accepted another position. So we are looking to get back to 2 full-time people to be able to manage the fair as well as our off-season events. So that's what you're seeing here at the top. The expenses that we probably have increased the most will be for our project management, contractors, for doing any of the capital projects that we have going on or will have going on. So we have increases there. We have increases in our capital projects themselves down below. I've got buildings and improvements at $245,000. Part of that 145 would be if we get the money through Business Oregon. The other 100,000 will be part of our TLT fund allotment and putting that towards a project, a capital improvement project. So those 2 are there. Really not a lot of other. I can say everything has gone up. We are no different than any other manufacturer, retail outlet. Everything will be more expensive. Hauling the hay, hauling out manure, fuel for all of our tractors. Our contracts have all gone up. Our entertainment has gone up. So all of these numbers show that increase. And it's not straight across the board. Some people have opted to keep their rates the same, but we increased with the things that we knew that were coming. So all of those things are already factored in here. Any questions on that?
So, Cammie, who's doing your service and maintenance? Do you have an employee that does that now, or?
I do, yes. So we still, and we have had one, Ryan Schmitz is my full-time maintenance staff, and he takes care of the entire grounds, as well as set up and break down events that we have.
Okay.
So Cammie, we talked about the electrical upgrades at the fairgrounds. Have those been started yet or done, or where are we?
Yes, so both of the TLT funded projects were approved through the county commissioners, and I've received the grant paperwork for those. We started the process by talking to different agencies as far as to do project management, figuring out who we can get to oversee some of that, because I won't have necessarily the time or the know-how. In the beginning, not a problem, but as these projects get bigger, we would like to get someone who some of the other things that we need as well. Getting bids on major infrastructure that needs to be completed and so on. So I guess the answer is yes, we've started, but we haven't actually, gone out to bid or anything yet. This is in the design and, the design phase.
Good. I'm glad to see it getting started. We spent quite a bit for a plan. Let's implement it.
Yes. So we have $250,000 for each of those projects to get both of those projects off the ground, which is the West Side Power, putting in new 3-phase power, and then also the expansion of the pavilion to bring in larger events and host events as well. And those will not reflect in my budget because those will be paid directly through the TLT funds.
What is account number 9040 on the expenditures on the off-season, the 180,001?
The 18001, that is the buildings and improvements, so that's my capital building and improvements.
But that took a pretty healthy jump up from 80,000, so what's happening with that?
Yes, that is the $145,000 from the Business Oregon, hoping that I will get that grant application. And we will be putting that, I spoke with Rachel and kind of collaborate a little bit. We decided that the best project for that application would be the West Side Power. So if I get the funds for that, this money will go towards that project and helping it get completed. And then the other 100,000 will be for facilities improvements, which comes from my $250,000 of TLT funds allocated to me. We're only planning to expense 100,000 of that. And it could be included in this grant application, or it could be included in a different capital project.
Okay, thank you.
But we've allocated 100,000 so that we could actually get something else completed.
Okay, any other questions?
So Cami, you talked about a project manager. Where is that reflected in your budget, or did you say that was TLT? I'm sorry, I don't think I was clear.
We have, so in each of those two grant applications, there's a small amount allocated in each one for project management, and then the other project management would be under either professional services or contract services.
Okay. Thank you.
And,
Yeah.
and also, Cami, this is Rachel, the annual allocation to the fair, we were looking at it coming out of there. So you have two 250 pots and then 200,000, I think it was, that the board wanted to give the fair for an annual allocation. So it could come out of there as well.
If I heard you correctly, Rachel, that was, yes, the two 250s in the TLT grants, and then 250 that was allocated to us. 100,000 I put into the actual project 9040, and then the other could come out of that money as well.
Yeah.
Any other questions?
I think we're all excited to have a full
Yes.
going fair this year, hopefully without COVID hanging over it, and just get back to as it could and should be. So fingers crossed.
Yes, I'm really looking forward to it, and, it's actually, it's a double-edged sword, but there are different pots of money out there, and we're hoping that we can, by getting somebody here, just even local, helping me, to kind of facilitate some of that. Some will be volunteers, some will be paid, but we're looking at, different ways of trying to take advantage of, like some of the shuttered venue money that is still out there. There's another allocation that fairs may qualify for, so we're all really working hard to get whatever piece that we can. And then I would be happy to amend my budget next year because I have more money and can spend more.
And we'd be happy to approve it.
Okay.
So one last question, can we, on the carnival people, they must have suffered during the last couple of years like everybody else. Are they back to full strength, or do they have personnel issues, or what's going on in that end of the business?
So for the Carnival Company, we had a little bit, I thought was going to be a setback because the Carnival Company that we use currently is Rainier Amusement, and yes, they did take a big hit, but they were able to capture some of the funds that were out there for their type of business as well. The biggest drawback for them is the H-2B visa workers. They are in the second round of allocations for those workers that they put in for. They're hoping, they won't know until the end of April, I believe, whether or not they have received those. So, employees are a big issue, but they are hopeful that we'll get the second round of visa workers. They have taken their carnival, they normally have what they call two different kind of allocations, so they have two different routes that they take. Well, they had determined that they couldn't do that any longer. So now they were down to one route, and the Tillamook County Fairgrounds was going to be without a carnival this year. But we were able to come to an agreement, and they are willing to do that. I had to look at changing our fair dates in order to accommodate them for next year, which was not doable because I have contracts that are already out, and I couldn't change it because of horse racing and so many other factors. So we are in search of a new carnival company. We are currently working to get a contract with a company out of California, and they are going to be hopefully coming on board. They will do Clatsop County, they will do Tillamook County, and Yamhill County, so that they may jump on the ship as well. So if we can get them up here, they're willing to change the company that they're currently with. So it has been a struggle. Just one more thing in the fair industry that we're dealing with. So yeah, I'm very thankful that they are going to be here this year, but I still have a lot of work to do for next year. So between horse racing, the carnival, and then new projects coming on, we're going to be very busy.
Well, you were looking for work when you came here.
Oh, that's a good one.
Let's see, I'll take something that was said previous. So talking about succession planning,
No, let's not go there.
I do not know who would be crazy enough to take this job on, honestly. But, we do it because we enjoy the work that we do, but it would be nice to be able to get a few people in here to give us a hand, so.
Do you have any prospects?
A few. We just posted again. We'll post it one more time, do a little bit of Facebook, trying to reach out to a few more people. I think the hardest thing, Mary Faith, is it's a really good atmosphere. We're pretty laid back. We don't require a lot, just a lot of public interaction. Everything else can be taught. The things on the computer can be taught, how to do spreadsheets, how to do, contracts, those kinds of things. So it's really just finding somebody who wants to work and during fair wants to work hard. I mean, there's no two ways about it. Everybody that comes to the fair should understand it takes a lot to put it on, but the more hands that we have, the easier the work is. So I'm hopeful that somebody will want to work in this industry.
Me too.
Yep.
Anything else? Thank you very much. Good
Thanks,
luck with
Amy.
all your challenges.
Thank you. Good to see you all.
All right, let's, one more to go today, and this is usually one of the big ones and more complex. Marlene, are you on, and your staff perhaps?
I am. I was just wondering if you were gonna take your break or if you actually got one on your
No,
schedule there.
we took a break earlier, we worked that in. Don't be concerned at all about our comfort. We're fine.
Well, why do you keep being concerned about our comfort?
I'll leave that to you then.
No.
Go ahead.
Yeah, I also have with me Irene Fitzgerald, who is my finance manager. I will, if we ask her questions, I can spin it around and we can include her in our conversation as well.
Great.
So, given that we have, last year was kind of a blur for me summary of items for you all. And are there any new people on the budget committee this year?
No, they're the same.
Didn't think so from the list, so
In
thought
most
I'd
cases.
check. Hello again. So
If you could do a
for
screen share with PowerPoint, that'll work, I think, right?
She said she doesn't have a.
Oh, she does, I thought you said you did, and we couldn't. Sure. Okay, sorry, go ahead.
No, we were discussing lamenting, like having some fun things in a PowerPoint, and I'm kind of glad we did with all the site visits coming up for different services that were postponed during the pandemic. Everybody's going, let's do them now. Anyway, so our budget overview here, as you know, the Health and Human Services Department provides integrated primary care with our federally qualified health center, also known as our community health center, and public health and environmental health services. So primary care right now includes 3 integrated services: medical, behavioral health, and dental services. And again, public health has a wide service array from things like home visiting all the way through communicable disease, things like COVID-19 response, emergency preparedness, and home visiting services. Public health also includes the emergency preparedness and response services, again, which were brought to the fore here and continue to be with COVID-19 pandemic and response. We also provide environmental health services. As again, you're probably familiar with these around, restaurant inspections, water systems, etc. And we coordinate Tillamook County Wellness and serve as the backbone and infrastructure support for that initiative. So that's a basic kind of overview of services, which most of you are very familiar with. The overview of our budget, like comparison from FY22 to this new upcoming year of FY23, our total budget is $13,675,940. Our difference from the previous year is 1.53 approximately million. Our total personnel cost increase between the 2 years is 126,000. Just giving you the high points around these differences between 1 year and the next. Our total indirect was an increase of 148,000 for this next year, from 428 last year to 576. Our contracted services item is an increase of 600,000. So that went from around 1.9 to 2.5 million. Another one that will stand out to you is our capital outlay item, which was an increase, or is an increase of 283,000 approximately. Previous year was about 75,000, so you'll see a big increase there to about 358,000. Those are the big items in terms of the budget differences. I think you'll see there may be others that you have questions about, but a little bit more detail around some related costs in terms of the summary of changes from 1 year to the next. So for our personnel, we're increasing 3.2 FTE. We had 58.3 last year, and we're looking at 61.63 this year. There's some specific items in there, but it's hard to pull them out with all the different positions, but they include a new medical assistant, an office specialist, and a portion of an increase in an FTE for a nurse. Basically, those are, the justification is based on demand for clinical care and the related support for medical records and managing the patient panels who have kind of postponed care here during the pandemic and doing some more outreach. Some of those costs are offset by continued Health Resources and Services Administration ARP funding. We still have another 168,000 in our budget this next year. Our material and services item is pretty much the same from the previous year at about 53,000. There's an increase of $3,000. So you'll notice a few things in there around laptops and software and things like that. Our computer software and licensing primarily based on the increase in dental services. We have been assigned pretty much the entire Medicaid population for Tillamook County to provide dental services to, as well as uninsured. So we have, as you know, opened our own dental clinic, and we are continuing to contract with 3 local dentists and expanding our dental team and adding mobile clinic services this year. Again, fingers crossed if we don't see COVID pulling our mobile clinic to other services, but that is the plan on that. I mentioned our capital outlay for building and improvements, so you'll see that increase as well. That is primarily for our expansion / improvement to our 8th Street Annex right next to our main clinic in Tillamook. That funding is from, again, the Health Resources and Services Administration Capital Improvement Grant. And we have started on that process here, but it will continue through probably 2 budget periods, probably 1.5. So that's the summary of those items that you'll see in our budget. A little bit more information around some of the projected revenue. Basically, the grants that I mentioned that are ARP funding, we had an increase in health, environmental health fees that we expect to generate around $10,000. Some insurance increases for assigned membership and additional new uninsured clients, and a Medicare increase of about $475,000. We did decrease our school contract services because we were not able to hire nurses. So we have a decrease of $30,000 in our budget for that. And I think that's pretty much it in terms of the major changes in our budget from this year to next year. But happy to go through any questions and also bring in Irene to answer any detailed questions that you might have.
Questions?
I sit on the health council, so I have a pretty good understanding of how this thing is operating, or at least, let's not say pretty good understanding, let's say that I kind of get what's going on. It's very
Well, it
complex.
is. Can't imagine, I just can't imagine what you've gone through in the last couple of years. Now, if I remember right, Marlene, you're a graduate attorney. Now, do you wish you'd gone into law instead of medicine?
Well, I've been also listening to the changes during, for COVID for landlord-tenant issues, and also relating to domestic violence and behavioral health. Shockingly, I worked in those areas as an attorney in social justice and representing folks who are in those. So one way or another, I was going to be impacted. But I really enjoy working with a great public health team and the entire clinical staff, and being able to work with commissioners who are really invested in their community. So it's been difficult, but it's been rewarding too. So yeah, I get the joke though. No, I don't want to go back to prosecuting or defense work, yeah.
So we've asked everybody else, or they've told us how many open positions they have. What's your staffing situation right now?
Right now, we usually review them weekly. I don't have that in front of me right now. I think we have about 5 open positions, and it might actually be a little more because I keep not counting the nurses because you can just never fill them. There's usually almost 5 open at any given time as well. And then we have several, similar number of new positions that we're trying to cover for people that have retired, because we can't fill the manager type of positions for the current pay that we're able to offer. So there's some significant gaps. We have tried to adapt with the nursing shortage to see how we can delegate duties to paraprofessionals with standing orders. So we're adapting that to be able to hire some paraprofessional staff and build up their skills. We've created some internal training pathways to build So it's challenging, and there's always opportunity for innovation as well.
I sit on the St. Mary's retirement home board, and they are having the same difficulty. Because if you get a nurse, somebody's gonna headhunt and grab the nurse, or they're gonna go to a different agency and become agency nurses where they can make $1,000,000.
8,000 a week or
Yeah,
something
so
crazy.
it's a nationwide problem. It's not just,
Well, I work with Eric, quite a bit at the hospital, and Commissioner Bell did as well. His most recent statement is there are no nurses living in Tillamook County on the night shift. None. Right now, they're all traveling nurses, and they get substantially more. They're paying, as much as several $100s an hour. And I also heard the Providence nurses are on strike, standing in front of St. Vincent. I happened to be in there a couple of weeks ago. I saw like 2 of them, and they want $73 an hour. Just gross wages for a nurse. So I don't know what our market is, but it's probably not that high. What does a nurse earn now, a full RN, let's say a 4-year RN?
Or on hours for a nurse 3 on the current pay scale, I don't even think it's $40 an hour. Top is $38.71 an hour. I don't know if you could hear that. $38.71 an hour is the very top of our pay range. For the very top, that's a 4-year degree plus 3 to 5 years experience to start. So shockingly, maybe again, we're not getting applicants when nurses are making as much or more than our mid-level providers are making. Putting out a plug there though for virtual telemedicine and making sure that we're, looking as a county to adopt. I know Commissioner Scar's a liaison to our department. We've discussed it, and she said, "Yeah, you're aware of those, and HR is aware of them as well." We're going to have to adapt, be nimble, whatever the phrase is, to be able to be responsive to community needs, because rural communities are going to definitely be cut off when folks who can make the higher pay are also moving to more urban areas. So we're going to have to look at some options besides just paraprofessionals when you actually have to have those professional people accessible.
We have some challenges in front of us as a county. We've talked often about, we get to this budget place and we don't have enough for the number of positions that we need. And I think we're gonna see an exponential jump here as we look at what has happened to wages, not only in the medical field, but we've heard Chris talk about truck drivers. It's just, we're not gonna be able to get the staff we need if we don't get into a pay position to be competitive. And once we get into a pay position to be competitive, we're not gonna have enough money for the number of people it takes to do what we do. So, and we're not alone in this conversation as a county, but it definitely, I think each budget cycle is going to get more difficult, we're gonna have to look at more complex solutions. And I think bring this conversation to the community. I think our community has to begin to understand what we're looking at in a budget sense. And we have to have that conversation that changes my county government's wasting my money to, oh my gosh, I see where every penny's going and we're not making it. So I think as a budget committee, that probably sits in front of us as additional work to support Sean in doing this, but really to carry this message out, because there will come an end point. There's, where it's just not gonna work.
Well, there hasn't been one department that's fully staffed that we've heard since we started.
No.
Everybody's got holes.
Everybody's got holes.
Tough positions there.
Yeah, and we hear from all of them that they can't be competitive in recruiting with the wages, because although we are a smallish rural county, we are not competing with smallish rural counties for our employees. We're competing with the metro areas that are right over the hill, and with the ability to work remotely, we're losing people like Damien who live here and work for us, who can now work for someone else while they live here where they live. It's getting really complicated.
And the cost of housing is so high here.
Yep,
There's no place to live.
If I was gonna say, if you can
somebody,
find one.
you can't
right,
live
and
there.
if you already live here and can get a job working remotely elsewhere, that's one less house essentially that's available, because it is taken by somebody living here, they just don't work here.
Well, and government is not as nimble as others simply because you want an annual cycle and there's X amount of dollars, like you said. A private business can say, okay, we're not in the market, let's increase something and find a way to do it and do it and have it done by the end of the week. It can't be done here, and that's just the way it is, but there are consequences for that approach.
Yeah.
You know? But I think you're right, Commissioner. This is a conversation, or that's a conversation that needs to be pushed into the community and really get some buy-in across the whole county.
Sean's giving me a really happy look.
I have one more question, Marlene. I've heard from the usual crowd, I guess you would say, about how messed up the state of Oregon is, and they don't know what day of the week it is, and on and on and on. What has been your experience or your department's experience with the folks in Salem? And, you know, I think they're trying their best, and they're good, decent, educated, honest people. But, you know, is the system not what it should be, or you know, what really has been your experience or your department's experience?
I think if I was like looking at it on a scale of 1 to 10, in terms of the ability for a state organization to respond to an unexpected event like this pandemic, I would still, I think I'd rate it between a 7 and an 8. When, you know, as a country, we aren't really prepared to respond to a pandemic. And so consequently, states similarly aren't prepared. Oregon, in many regards, has been touted as, oh, if we would have done it like Oregon, we would not have had so much of a spread in XYZ state. There were things about communication that did not go well and improved. There are things about communication that didn't go well and never improved. So the information flow was so quick that it was really difficult to stay on top of trying to get as much current information as possible to our community. So we constantly just badgered and kept asking. So I think the state, again, with just like the community, had gaps in staffing, and they were still trying to respond. So despite what, you know, I feel like we were hearing from community members and some elected officials, I think that there was a pretty good response from the state to our requests, and I think we tried to rise to a challenge and would hope that we at least fell in that same range if I had to pick as, you know, 1 to 10, that we were able to try to meet the vast majority of needs. So definitely room for improvement, but I was surprised by really how quickly people were able to shift their focus.
Thank you.
As a commissioner, we were getting weekly meetings or more often with the state. You know, they were trying, but this thing was going so fast,
Yeah.
and even the national information changed from day to day, and they were having a hard time keeping up too, just like everybody else. I really couldn't complain. I think they did the best they could.
Well, you know, hindsight is 20/20.
Yeah. The only time I got really a little hardliney on it was when the governor wouldn't close down the beaches and everything, and we requested her to do that. So that left it up to us.
That's when we stepped in and
We did.
closed down all the parking areas.
Sparklighting is a great adjective.
Oh, it's one of those part line ideas. That's not going to stick on the wall.
As long as it sticks for a little while, that's all we need.
It's mostly getting people to think what outside the box.
One other question, Marlene. Where are you now on the north and south services in terms of expansion, or be steady as she goes, or whatever? what's happening at the south and north ends?
So now, looking back up, even, hoping again, knock on wood, that we don't see another variant, we are focusing on expanding dental services to North and South County. In fact, we've been having meetings the last couple of weeks, looking at partnering with the school-based health center in South County. North and South County, we've also expanded our harm reduction programs to North and South. We are have been working with South County on emergency response and expect to have a more robust, engagement with Tillamook as well, to work with the new county emergency preparedness coordinator for medical and behavioral health services in North and South. North County, there are Reinhardt and Adventist Health are still covering North, and we have services in Rockaway Beach. In South County, again, I think our strategy really is to work and support the community with what they're trying to do with the school-based health that could also be expanded access to the community as a whole. Likely kids and families seems to be a big need around, again, behavioral health and dental. So that's our plan right now. There's mobile clinic services are in that mix as well.
Thank you. Anything else for Marlene or the health department folks?
I just wanted to get her comment on the BA2 variant. Are we gonna dodge a bullet on this one, or is it just gonna keep growing? I just looking at the numbers, Oregon just reported 540 cases today, and it's clearly inching up again. You guys got a magic ball there, is what's gonna happen?
It depends on which bullet we're dodging. So if we're dodging the bullet of disease, severe disease and death, I think that we will, with a high percent of people that are vaccinated. For folks that are unvaccinated, older with chronic disease, that is where we may not be able to dodge the bullet even with this variant. But overall, I expect, again, because the high percent of folks who are vaccinated, that we shouldn't see the high rate of hospitalization and death.
Hope you're right.
So Juanita, I've got one bitch for you. So I am a patient now of the health clinic. When Dr. Brown moved from Bayshore, I followed Dr. Brown. I love him as a doctor. So when I go in, you don't collect the $20 copay off of Warwick County Insurance. And so I get a bill in the mail a month later, and I get to work early. I'm in the courthouse by 7:30, and I leave sometimes after you guys are gone. But when I did finally get in to pay that $20 bill, I had to wait for 3 pieces of paperwork to pay a $20 bill. I mean, I appreciate the fact that we have to cut down trees for all that paper. I do. But if there's anything you can do to streamline that, or especially to charge me the $20 copay when I go in, that would be amazing. It really would be.
Irene was like, oh, still get the 3 pieces of paper, but
You take the copay, when you come in, they're supposed to ask you, you have a copay and ask for the money. So there's like a multiple receipt process. One's out of the Epic system or electronic health record system, and then they have a manual receipt book. So process-wise, it's probably still 3 pieces of paper. And
but you could offer to say, I want to pay my copay.
oh, yeah, you could always offer, but we should be asking every time.
Okay. So I'll remember that the next time I go in. Can I pay my copay now so I don't have to come back? That's great. Thank you.
Yeah, I forget to, or my kids do. So, yeah.
And I have found that people like you and I that go in there, they oftentimes don't ask us for our copay. They won't ask me for mine. Not sure why I feel like saying you should be asking me for my copay.
Yes. Yeah. That way I don't have to come back. And you don't have to send out statements in the mail. Perfect. Thank you.
Anything else?
I wanted to apologize for not including other health council members as an invitation to these budget meetings. I years now. And I completely forgot to include them in these budget meetings. So we definitely share our budget with the Health Council, and we'll continue to have conversations around many of the strategies that we talked about here. Because we can and do generate revenue, we look at ways to both diversify and to provide sustainable clinic schedules so that we can pay for the services our community needs. So my apologies for not including members. Erin's here, obviously, she's the commissioner, but she's our liaison. And Commissioner Bartline, former Commissioner Bartline, also serves on the Health Council, as he indicated. So I will let them know and apologize to them as well. So thank you for your time. I appreciate it.
Thank you.
Okay, thank you.
Marlene.
Okay, I guess we're done for today, and we reconvene tomorrow at 9 a.m. So until then, we will stand adjourned.
Right on time.
Right on
Well,
time.
look at that.
That's how you run a meeting.
On the nose, my golly. I am impressed.
So can you leave everything up tonight then? Okay.
I would not leave your laptops in here, but you can leave your books.
Yeah,
I just remember you're about 50 feet from the jail.
Hopefully they
We're
can't
hopefully
get out.
they're remaining, right?
Hopefully they don't get out.
Yeah.
So yeah, you can leave. Oh, one second.